November is National Epilepsy Awareness Month, and according to the National Epilepsy Foundation, 1 in 26 people will develop epilepsy in their lifetime. Carolee McGrath sat down with a doctor from the Neurological Associates of Western Massachusetts to learn more.
Epilepsy is a condition in which you get seizures. Bottom line, it doesn't really mean anything else except it's a condition in which you get seizures. So the next question is, what is a seizure? Seizure is an abnormal electrical discharge in brain. It is not a problem with plumbing of brain, arteries or veins. It is a problem with the electrical circuitry of brain. So whenever there is an abnormal electrical discharge, that area, wherever that abnormal discharge is, that area of the brain doesn't work, and that causes some symptoms which are seizure symptoms. And somebody who has seizures, that person is called to have epilepsy.
So what is the background or the cause behind, leading up to the seizure? Like, what is that, and how does that affect different people differently?
Well, the causes could be numerous, but maybe one way to look at this is following. Most of the seizures, or majority of seizures, start in young age. And in young age or children, causes are different. Some of the causes are genetic. There was some abnormality in brain children were born with. Some of the causes are something happened around the birth time. Child might was premature, or brain didn't get enough oxygen for a while, and these kind of reasons. Sometimes just pure mechanical trauma. So there is a population in childhood that gets seizures. And then in about, I would say, in adolescence or early 20s, usually a lot of men get into epilepsy because of trauma, because they are involved with risky behavior, and they are more than women involved in, let's say, motorbike accident or similar kind of sports. So they can have seizures. And then there is a kind of plateau until people are in later part of life, like 60 plus. And then they get seizures from a different reason, usually speaking. They get seizures from strokes they tend to have. And strokes really are not that uncommon. So the scarring from stroke causes that abnormality in brain that leads to abnormal discharge, and then you have seizure. The next question is, what is the symptom of seizure? Well, that would depend upon wherever that lesion is, abnormality is.
So let's talk a little bit about children, though. Especially a parent who is this new baby or a toddler, and this happens. This obviously is incredibly frightening if you're not expecting this. What symptoms could there be presented that might give somebody kind of a heads up?
Well, even in children, we have to, maybe it is better to just talk about few years old children, because in very young age, it's a different kind of scenario. Mm-hmm. Generally, in very young age, meaning children who are just born or a few days old or a few hours old, they generally present with generalized shaking type of episode. In that age group, if there is minor movement, you may not be able to judge it, because when the child is moving all the time, you don't know what it is. But the generalized kind of activity is known, or they become unresponsive. That's the presentation of seizures. In later life, seizures always present in this kind of symptoms. Some seizures are called sensory seizures, meaning you only have an abnormal sensation somewhere in the body. They are not that common. More common seizures are motor seizures, when you have some movement of your body which you are not trying to move. Mm-hmm. Even more common are what we call complex partial seizures, where mind is altered. So, in fact, one way to classify seizures are partial seizures, when only you have a movement or sensation, but your mind is not altered. You know what is happening. But in most of the time, what happens is that your mind is slightly altered. You become kind of unresponsive for a few seconds or a minute or two. Or you just stare in space. People who are sitting with you, they know something is going on. Patient himself or herself is totally oblivious kind of what happened, other than just knowing after the fact that I missed few moments or a minute or two of the conversation or something.
How long does it last?
It usually lasts few seconds to a minute or two, not very long. Brain has some kind of auto mechanism that it shuts it off. Sometimes brain is not able to shut it off, and then it goes longer. And sometimes it really triggers another mechanism in brain which leads to a generalized seizure. So the seizure could be not generalized. Generalized means the whole body is seizing. And there is a separate mechanism for that. Not everybody has that seizure.
And what kind of medication can be used to help treat people who suffer from this?
Well, before we go to medications, anybody who has seizure-like symptoms, the first question is, these symptoms which are presenting, are they seizure or not? That's always the first question. Children, adults, any age. Because they are seizure look-alike. There are things that could look like seizure. And first they have to be looked at. For example, commonly anybody can feel dizzy and pass out for a few seconds for whatever reasons. That may not be seizure. That's what we call syncope or fainting or passing out. Of course, you can pass out from seizures too, but many times you don't. So the first thing is to figure out if this is really a seizure. And that is done by taking good history and exam and also a test called EEG. Once we have determined it is a seizure, then the next question is, what type of seizure? Because the choice of medicine would depend upon what type of seizure we are dealing with and what age group we are dealing with and what other issues patient has. Is this a male or a female? And so many complex decisions, and ultimately you reach a point that you prescribe a medicine, and there is a large choice of medicines now.
In addition to suffering from epilepsy, there has to be a certain amount of anxiety that goes into this. Obviously, for parents who have kids who are suffering from this, perhaps not knowing if something is going to occur. How do you help patients deal with that on top of the physical thing that you're dealing with as well?
So usually when patients present with seizure-like episode, I educate them. And the way I present it, there are three types of implications of having seizure or epilepsy. First is medical implication, which is you may fall down, you might hurt yourself if seizure is larger, and very rarely, it is rare that patient may pass out from seizure. That might happen just because of seizure from choking, or it might happen if you were sitting in a soaking tub and had a seizure and you drown. Something can happen. So precautions should be taken. So there are medical implications of seizures. Second is there are social implications of seizures. If you are with your family or with your girlfriend or boyfriend and somebody, classmates, you had a seizure, co-workers, right then the whole relationship changes. So there are social implications. And third is there are legal implications of seizures for adults especially, because every state requires to put some driving restrictions if you have seizures.